Pleasure. Anne-Marie, pleasure. Thanks. Thank you all for being here.
Wonderful.
Amazing.
Should we go ahead and get started?
Absolutely.
Yeah,
Let's do
okay. Wonderful. So good morning officially, everyone. My name is Andrea Nelson. I'm the Director of Client Services here at the Western Ottawa Community Resource Centre. I'd like to start this morning off by acknowledging that we're gathered on the ancestral and unceded territory of the Algonquin Anishinaabe Nation. So it's really great to have you all here this morning. Il me fait grand plaisir de vous accueillir aujourd'hui au Centre Ressources Communautaires d'Ottawa-Ouest. Oral health is an important part of Canadians' overall health and well-being. Regular visits to an oral health provider have proven to reduce the risk of tooth decay, gum disease, and other serious health problems such as cardiovascular disease and stroke. But for some, receiving proper dental care feels out of reach and unaffordable. That's why we're here today. So joining us to speak about today's announcement is Jenna Sudds, the Minister of Families, Children, and Social Development. Minister Sudds.
Amazing. Thank you. Good morning, everyone. Bon matin tout le monde. Thank you. Thank you so much, Andrea and the team here at Western Ottawa Community Resource Centre for hosting us here today. I have to say, this room actually brings back lots of fond memories for me. As my daughter graduates from high school today, we spent a lot of time in this room many years ago, so it's fun actually to be here today as well. So as a mother of three, I have some lived experience in understanding how expensive children are, but also how expensive dental procedures can be, and the impact that it has on our kids when parents can't afford those dental procedures. Poor dental health has caused more than 2 million missed school days annually here in Canada. And that's just not acceptable. We can do better. No parent should have to choose between taking care of their kids' teeth or paying the bills. Aujourd'hui est une étape cruciale dans notre plan d'étendre un pays où chaque personne peut accéder aux soins ou au soutien dont elle a besoin. On behalf of Minister Holland, I'm thrilled to be here today to announce that as of today, parents can now register their children under the age of 18 to the Canada Dental Care Plan. Also, adults with a valid disability tax credit certificate are now eligible to apply. With this plan, we are building a Canada that is affordable and that puts healthcare at the forefront for everyone. We're not just building this type of Canada for today's generation, but we're also building its lasting benefits for generations to come. Since we launched our plan, we have already seen more than 2 million Canadian seniors register, and we've already seen 200,000 of them receive care. I know I had a call recently, just last week, from a senior here in Kanata who had received treatment, dental care, for the first time in over a decade. And she was just without words, so ecstatic about being able to access this program and the impact it's having on her life. So with today's announcement, around another 1.2 million more Canadians will soon have access to affordable dental health checkups and treatment. And the Canada Dental Care Plan will eventually cover up to 9 million Canadians. Canadians with incomes, family incomes of less than $90,000 who currently do not have access to dental insurance. We've also made the process simple. We have an online application process that is as easy as possible. Having said that, of course, online is convenient and easy to use, but I do want to emphasize, despite the digital-first approach, that does not mean digital only. For those who would like to apply on paper or in person, they can do so by visiting a Service Canada agent and our service clients, or who will serve clients in person as well. So since 2015, we have been focused on delivering programs like this that make children's lives better through many stages of their life, from childcare to skills training and now to their dental health care. Le budget de 2024 s'appuie sur ces progrès non seulement pour continuer à soutenir les enfants, mais aussi pour battre un Canada et faire croître une économie qui fonctionne pour tous. All Canadians deserve the opportunity to succeed. That's why we are moving to help build more homes faster, to make life cost less, and to drive economic growth that ensures that every generation of Canadians can reach their full potential. We will relentlessly fight for Canadians, taking concrete action to strengthen the middle class and make life better for everyone. Merci beaucoup, and I will pass the floor back to Andrea, I believe.
Thank you. Thank you, Minister Sudds. On behalf of the team here at Western, I want to extend our gratitude and our support for this announcement. Today marks a significant milestone towards a more equitable healthcare system, one that truly serves vulnerable and equity-deserving members of our community. And here at Western, we operate from an equity framework. And to that end, we and all of our sister community health and resource centers are committed to promoting safe, high-quality, affordable health and social services for everyone, regardless of their background or their circumstances. We believe that everyone has the right to good health. And the Canadian Dental Care Plan aligns beautifully, I think, with that vision. The introduction of barrier-free dental care represents such a leap forward. For those children whose families face significant challenges in accessing dental services, they now have earlier and more comprehensive support for their oral health needs. This initiative also holds particular significance for people with disabilities. This is not just about dental care. It's about empowering individuals in their quality of life and fostering better health outcomes for everyone. This plan is about removing barriers, addressing systemic inequalities in healthcare, and promoting a community where everyone can live their healthiest lives. When our clients come to us for service and disclose, or we recognize that dental services are necessary, we now have an accessible referral pathway that we can share with them. I know that everyone in our sector is looking forward to the positive impact that it'll have in our community and beyond. So today's event is an important step in making oral health care more affordable. And I know that many families in our community are feeling the pinch of financial uncertainty right now, and this will help alleviate some of this stress. Thank you, everyone, for coming. Je vous remercie d'être venu. And I will now hand it over to Geneviève, who will coordinate questions from the media. And please note that will be available for photo opportunities and questions after this. Thank you.
Oui, nous allons maintenant commencer la période de questions pour les journalistes qui sont parmi nous. Veuillez vous introduire ainsi que votre média. Un rappel que c'est une question et un suivi. Thank you for being here with us today. For the journalists who have a question, a reminder that it's one question, one follow-up. We will go at that mic. Just line up there. Thank you.
Hello, Neville Hunt with the Community Voice newspaper here in Kanata. Dental problems can become healthcare problems. Have you done the math on the potential savings in reduced demand for healthcare if this next cohort is covered by a dental plan?
Yeah, thank you very much, Neville, for being here and for the question. You are absolutely correct that dental care is part of healthcare. And as we did the work to, make this program come to life, as we formulated it, similar to the work we're doing on pharmacare, those longer-term healthcare costs are absolutely a factor. We know that preventative care, and in this case, preventative checkups, routine cleanings, these prevent issues that come along later in life and even through later in childhood, frankly. So undoubtedly, these investments will pay dividends for years to come. in healthier children, healthier Canadians in the long term, and absolutely the impact on our healthcare system.
Is there math already done to show that?
I don't have it at hand, Neville, but I'm happy to share it after the fact.
Rosalie Sinclair for Radio-Canada CBC.
Right.
We know that there is 45% of the dental care professionals that are in the program, that participate to the program. Is there a strategy to have more of those dental care professionals to be a part of it?
Yes, absolutely, and thank you for the question. You're right. A big part of our effort over the last few months has been ensuring that dental care practitioners and dental care offices were part of the program and had the tools that they needed in order to sign up and fully understand what the coverage would be. You know, my colleague, Minister Holland, has certainly been very active in this regard across the country, ensuring that practitioners had the tools that they needed. It's my understanding to date we have 11,400 dental practitioners currently signed up. Later this summer as well, the program will morph into an opportunity for any practitioner to be able to give these benefits to clients as they come without already having to have opted in. So there's a tremendous amount of effort, rightly so, to ensure that our amazing dentists and dental practitioners across this country are well informed and have the tools that they need to be able to offer this. I know here in Kanata, I was at Gateway Dental Office recently, and we had a discussion about this program, and they have opted in. They were quite excited, frankly, about the opportunity to be able to offer this to some of their clients who in the past they've seen and they've had the client hasn't been able to receive the service because they haven't been able to afford it. And I mean, the reality is that's really hard on dentists and dental practitioners who care so deeply for their patients and for Canadians. So the dentists that I've had the opportunity to speak with here in my community have been really excited about the opportunity.
And also for patients in rural communities, you know, the dentists are saying it's harder for them to get treatment because there is, like we are missing staff. Is there any plan to address that? Because people that living in those regions don't have access because of that staff shortages.
Yeah, that's a great question. It is a point of conversation that we have been having as we've been rolling this out amongst my colleagues. And there is a concerted effort on the ground to make sure not only the awareness, as we've talked about, but to your point, there are communities that are currently underserved when it comes to dental health. And there's work underway. Minister Holland and some of my colleagues are leading, working with the various associations across the country to look at some of those underserved areas and try to attract more dental practitioners and dentists into these communities. Merci.
Thanks, Minister. Rachel Haynes from CTV News. My question to you is about the reaction to the by-election loss. It's been a couple of days since your party lost the by-election in Toronto, St. Paul's. Yesterday, your cabinet colleague, Mark Miller, said there needs to be some introspection here. So I want to ask you, what specific changes would you like to see to be able to get that trust and popularity back to your party?
Well, thank you for the question, and undoubtedly, the results were disappointing. But having said that, you know, when I reflect on the work that we have been doing and the work that we have ahead of us, you know, no time like the present to ensure that we're delivering for Canadians. I think it's fair to say, as I go door to door and I'm across the country, I hear from Canadians who are struggling. It has been a difficult time for many people. And, you know, that's why I think progress like we're sharing today is so important. When we talk about, you know, 1.2 million more Canadians who will be eligible as of today for dental care. When I share this story of the senior that I spoke to last week here in Kanata who was able to receive dental care for the first time in more than a decade. when we talk about moving forward with pharmacare and providing free contraceptives to those who need it. When I am across the country working with the provinces and territories to open more childcare spaces so families have access to affordable, high-quality childcare. These are very tangible programs and results that Canadians are benefiting from. And I think it's important to reflect on that work, but also to be laser focused on continuing to push forward with these programs and supports that we know are needed here in Kanata, in Ottawa, and across the country. And, you know, I contrast that to the alternative. And frankly, you know, when I look across the benches at the leadership there of Pierre Poilievre and the Conservatives, the progress that we have made, these programs like the dental, like childcare, like pharmacare, they are at stake. And that is the reality of where we are at. And so to me, the stakes have never been higher. I have never wanted to work harder with my caucus and in my community to ensure that this progress can continue, that Canadians can continue to rely on the programs and supports that we've been working hard to put in place for them.
With respect, some of these programs like dental care and pharmacare and childcare have been announcements that you had made in the last couple of years. And a couple of days ago, Canadians were given the choice of whether to go with that or, like you're saying, the alternative across the aisle, and they picked the alternative across the aisle. Do you find that, is this showing that your party is potentially out of touch with Canadians when you're saying you didn't give any specific changes that you think need to be made?
Well, I think it's an important moment to pause. I think it's important to take stock. I think it's important to continue to speak with Canadians in every community across this country. But I also think it's the opportunity to double down, to demonstrate results for Canadians. That's when they feel it, when they go to the dentist and they're able to get free dental care, when they are able to get a childcare spot at $10 a day or 50% of fees here in Canada. That's thousands of dollars each year that they are saving. That's just two examples. Pharmacare, obviously just starting, and you know it'll be a few months until the impacts of that will be felt. But each one of these programs, when you add them up and you stack them on top of each other, when you add the Canada Child Benefit, which you know has lifted hundreds of thousands of kids out of poverty, families get each and every month in their bank account. You know, when you pause and you reflect on the impact of these programs, I think it's an important moment. It's important for us, as I said earlier, to continue to fight for them, because I fear the Canada where those programs don't exist. I fear the Canada where families don't have that support when they need it.
And just before I hand over quickly, is the Prime Minister the right person, the current Prime Minister, Justin Trudeau, the right person to lead your party in the next election?
Well, as I've just outlined, the many programs that have been underway over the last number of years, those programs were spearheaded by our Prime Minister, by his vision, by his dedication to Canadians. And the impact of those programs is phenomenal. I have the opportunity to speak with people here in Kanata and across the country on a daily basis. And it's important, again, that we take stock of that progress, but we also give credit where credit is due. And our Prime Minister has been steadfast in his leadership, in his commitment to leading this country through difficult times. And as we demonstrate here today, when we can point to 200,000 Canadians who've been able to access free dental care in just a few months of time, you know, this is just one proof point of what I believe his leadership has been able to accomplish. And I continue to stand with him and my colleagues and believe wholeheartedly that we are the party to continue to lead this country with our Prime Minister. Thank you.
Good morning, Luigi Delapente with Global News. What does your government think of the Alberta announcement to opt out of the federal dental care program?
Thank you for the question. It's obviously a relatively new development. In speaking with my colleague, of course, Minister Holland, who leads the dental care and our health care file, he has said already, of course, he's open to engage. The ultimate goal here is to ensure that Canadians across this country who need dental care have access. And so Alberta has a provincial program in place. So let's sit down and see those numbers, see what that coverage is, and see how this plan, the Canada Dental Care Plan, is actually augmenting that. We've seen thousands of Albertans already register. So we know that there is an interest in Alberta, but as my colleague, Minister Holland, has said, he will lead those discussions, and I have confidence in him doing so.
All right, I think this concludes today's question period. Thank you so much. That's it.
Excellent. Merci beaucoup. Thank you, everyone.